Hi, everyone. You're listening to Let's Psyconnect. This is LT.
And this is Ronnie.
So we are here today with our guest speaker, Dr. Patsy, and she was here before with us. And so we're excited, first of all, to have her back here. Ronnie is going to do an introduction, and she's also going to introduce herself in a little bit too. But the reason why we got her back here is because we wanted to hear from somebody else on a topic. So the topic is recovery. And she has experience with the subject. She's going to mention about her experience in a little bit too. And if you have listened to our previous episodes, we talk about recovery. For instance, recovery has been defined as living a fulfilling and rewarding life, even in the ongoing presence of a mental illness. Another definition of recovery is gaining and retaining hope, developing an understanding of one's abilities and disabilities, and engaging in an active life and acquiring personal autonomy, social identity, a and meaningful and purpose in life. So a positive sense of self, right? So we talked about the different definitions and how it comes to be combined and seen by mental health professionals, and also how there is a discrepancy even when it comes to understanding what recovery really means. So we're going to try to address this and other questions with Dr. Kester today. So without further ado, let's give her, well, actually, Ronnie, go ahead and introduce her.
ULT. And yeah, uh, very excited about today's topic, today's conversation with Dr. Patsy. Thank you so much for coming back. And I think it's very important in many different realms, right? The word recovery can mean so many different things, and we're going to try to tease apart some of the underlying themes of recovery and how we can think about recovery in different ways than just maybe the usual term that is used on a general basis, right? So let me read just a short bio from Dr. Patsy. Uh, Dr. Patsy is a doctor in clinical psychology and a postdoctoral fellow at Hazelden Betty Ford Foundation. Currently, Dr. Patsy is a mental health provider in the detox unit at HBFF. Previously, she has worked with patients at the residential day treatment and intensive outpatient level of care. Dr. Patsy has also worked in other residential treatment facilities as well as in residential drug programs inside a federal prison. Within the private practice, she has diverse training and has provided mental health services to sex offenders as well. Her dissertation was a literature review exploring the efficacy of yoga as a treatment intervention for substance users. Dr. Patsy's mission as a mental health provider is to reunite family members with their loved ones. And Dr. Patsy, thank you so much for coming back.
Yeah, thank you guys for having me back on. I feel honored. Thank you.
Yeah, that's awesome. So one of the things that we want to again ask you is that I alluded to a couple of definitions of recovery that has been put forth by different agencies, organizations, and whatnot, proposing again the idea of recovery and mental health coming all together. So, what is something that I guess comes to your mind when you hear the word recovery and
Mhm.
when you put that word in the mental health field?
So recovery is just it's so infinite, the possibilities. There's so many variables that we can think of. But to me, how I see recovery in general is just living a life that's worth living, free from the chains of whether it's addiction, mental illness, codependency, behavioral addiction. Again, the list can go on and on. So living free from those chains and living a life that is manageable. It's not going to be happy. It's not going to be hashtag best life, right? But it's going to be a life that you can manage and that you know how to manage. And then when you add the mental health portion of it, it's just that it's being able to go through the ups and downs of mental illness, whatever that looks like for you.
Mhm.
For a lot of mental health disorders, that it's a lifelong journey, right?
Mhm.
Even for depression, you can be in remission, but then you can have another depressive episode. So being able to almost like ride that wave in a safe and healthy way, to me, that is recovery.
Yeah. And you just mentioned, right, even with depression, it's something that you can be in remission. And a lot of people don't, we feel like a lot of people don't even realize what that really means.
Mhm.
Because again, recovery and the word remission, so both words are often utilized when it comes to substance use and abuse, right?
Mhm.
And so when you're talking about depression, like, oh, you're in remission from depression, what does that mean? And one of the things that we alluded to, Ron and I mean, we in previous conversations, the fact that once somebody's given the diagnosis of depression, they have the impression that they're gonna be depressed or they have the diagnosis for the rest of their life. So share your thoughts about that, please.
So yes and no, right?
Mhm.
It's almost like what effort are you willing to put into, like, how sick do you really want to be the rest of your life? Are
Mhm.
you going to work whatever program? Are you going to go to therapy, take medications, live a healthy life to manage your depression? Or are you just going to give in and, well, like, well, this is my faith, this is what I'm meant to be, I'm meant to be depressed. And i
Amazing.
i and I say this even from like personal experience, because full disclosure, right now I'm going through a big transition right now in life and career, and my depression is like full force right now. And it's really scary because I feel like I know all the answers and I feel so helpless at the same time,
Right.
right? So, in again, it's really trippy being a mental health provider and having mental illness and battling both of those things. But how, to me, it's like a daily thing. Like, how depressed do I want to be today? And what can I do to not be as depressed today? And then all those things add up. And remission looks very different. Remission can be because of medication. Remission can be like, okay, I just don't have symptoms. Remission can be actively working, again, a program of therapy, nutrition, holistic, whatever that looks like for you. So there's many ways that you can be in remission. But also, I think acknowledging that that might come back, right?
Mhm.
Even with substances, you can be in recovery for 20 years and you can still have cravings. You can still have really bad days and say, you know what, I'll just have a beer and that will
Mhm.
take it away. So
Right.
it's constantly going to live with you, but are you going to live with it? A patient just told me this like 2 months ago. I thought it was genius. Is your mental illness or addiction going to be the monster next to you? Or can that monster just like be next to you, kind of be, remember from Monsters Inc., the Sully,
Yeah.
that really funny, cute one? Like,
Totally.
can you learn to live with your monster and like read the newspaper with them and have your cup of coffee and they're
Mhm.
just part of your life? Or are you going to let them take over?
Mhm.
Sure. Yeah. And let me ask you, just from the clinical point of view, when you're working with a patient and providing them with psychoeducation and working on the treatment plan, do you implement recovery and relapse quite a bit in that conversation, and do you normalize it?
Yes.
Okay.
Relapse is part of all types of recovery, not only of substances, but of anxiety, of depression, of bipolar. It's all part of it. It's just part of our nature, right?
Mhm.
So yes, so I actively work on talking about relapse and relapse prevention. For me, one of the skills that I find most valuable working with treatment plans in terms of relapse prevention, so my patients get really stuck with, oh, I'm not supposed to future trip, right?
Mhm.
I keep hearing like, oh, I can't think about the future, be in the here and now, one day at a time. And it's like, well, yeah, but so how I reframe it is, what are you doing today that is in alignment with your value of wanting to be whatever 10 years sober, right? So I'm giving you, I say it like I'm giving you permission in a future trip, but framing it in a way of what are you doing today that is preventing relapse, right?
Mhm.
That is in alignment with your values of being a good father or being a good mother or having a career, whatever that looks like. So to
Mhm.
me, that's a very easy, to me, I've had a lot of success doing that with patients as part of their treatment plan and thinking about relapse.
Yeah. 'Cause what I want to comment on this and then go back if I can
Yeah.
remember all the things. Because one of the things here too is I mean, when it comes to the definition of recovery, right? One of the things that we alluded to is to have a purpose in life, to have a meaning in life, and that is associated with looking at the future too, right?
Mhm.
So because it keeps you going, and it gives us a sense of direction. So yes, we want to be present, and even in one way, take day at a time, at the same time, we want to know what direction we are going to. I think we are raised in a society where like it's important to have goals. We're not saying like have goals that are not realistic. So again, it comes with being realistic and learning what's realistic and having the resources to achieve them and whatnot, right? So it having that idea gets normalized to them because it's okay to look at your future, and it's going to create some level of anxiety. It doesn't mean that it's going to be a maladaptive anxiety either, right? So being okay with some feelings that it's unknown. I don't know if I'm going to reach that, but it's a purpose. I have that goal in my life.
And you have control. So a lot of things, what happens with that anxiety of like the future is a lot of us feel out of control. Like right, like you just said, LT, like I don't know what's going to happen. I don't know. But what you do have control is over your behavior right now at this moment. And think about a simple fork in the road. One side is you being in alignment with your recovery and all these good things in your life. And making that left turn is going back to relapse or maladaptive behaviors. You have that choice to go left or right. So which one are you going to choose? And every behavior you engage in today is that choice. Which choice are you going to make? And every time you make the right choice, you're closer to your goal.
Yeah. And then so just with that too, like the right and left, turning and whatnot, in addition to something else you said earlier, I thought of, I don't know if you guys have seen it, it's Passenger on a Bus. It's very much aligned with ACT. It's basically explaining ACT or ACT, Acceptance and Commitment Therapy to patients. And it shows a passenger on a bus and the different passengers come in a bus in addition to like you, but there's a passenger who is like very angry and another passenger who's telling you a bunch of things, and it's basically, and then signs on the road telling you like go this because it's a quicker route, so basically trying to figure out how to sit with the feelings and sit with the monsters, or the voices telling you different things, but it doesn't mean that you have to engage with them, right? And it's learning process, and like how do I sit with these voices in this reference here, or the monsters or whatever it is that's trying to detour you, and that or if you do take a detour, or if there's a bump on the road, and it shows in the video too, that it's okay as well. And then you're gonna be able to still go behind the wheel and continue with the bus too. So that's the idea too, that I think a lot of people, when you think of mental illness, they don't see that, right? Maybe they just see the hole and they fall in that hole, and then like, how do I get back up?
Right. And there is hope, right? That's recovery. That's the hope.
Yeah. So how do we go from actually instilling that hope and make it more in a way that, okay, let's assess recovery, let's talk about recovery, making it a path that is clear in a way that can be clear, because it's not 100% clear to the patient when they come into your office, because a lot of them don't even believe that they're going to be able to recover. You mentioned like depression. Thank you again for being so vulnerable and opening up to us and to the audience too. A lot of mental health professionals do struggle with mental health conditions and symptoms in many ways. And so thank you for also bringing that up.
We are human, right? At the end of the day, we're human.
And so how do we open up the discussion with our patients and like, let's talk about this, I understand the society has taught you something else, but this is what we know now.
It's going to sound really cheesy what I'm about to say, but making recovery cool.
Right.
Like making it cool. Again, it sounds really cheesy, but not only is me as a clinician, but me and my, kind of side gig of Instagram and all this, that's what I'm trying to do. It's show like, hey, recovery can be cool. It doesn't have to be only 12-step meetings and being sober and drinking water. You can have a fun, fulfilling, joyous life in recovery, right? And it looks so different for so many people. I was just hearing a conversation earlier this week at work where one of our clinicians was at like a party on a boat, and he bumped into one of his old patients, and there was alcohol there. And he's like, he's been 3 years sober. He had the best time. He had his Mountain Dew and he was just with us the whole time and had a great time. I'm like, that's fabulous. It's really making, so one, making recovery cool and accessible, and two, breaking the stigma, really breaking the stigma, not only of recovery, but of addiction and mental illness. A lot of times, society and media portray addicts and people with mental illness as like the junkie or the hobo, which I hate that word, but all these like negative connotations, people of color, right? We need to stop breaking that stigma. People in recovery are your boss, are your banker, your doctor. Y'all, when you go to the doctor, a lot of your doctors are either in active use or in recovery. Sorry to break it to you. And I'm telling you this
Yeah.
because I've treated them. And that's
Mhm.
scary. Now I go to the doctor every time and I'm like, oh, I hope he didn't, have the extra bottle of vodka last night. But the reality is, we are surrounded by people who are either in their active use or in active mental illness
Mhm.
or in recovery or both,
Mhm.
right? Or in this constant state of going in between both. And we have to normalize that. We have to open up these conversations. And I'm going to add the level of within our culture. I identify as Puerto Rican, as Latina. In our culture, we don't have these conversations. It's
Mhm.
taboo. You don't have feelings, right? You don't cry. And if you have feelings, you better just tell your priest in confession and that's it. But we need to start having these conversations. And I'm guilty of still learning to have these conversations for myself. For my therapist, I can tell him everything. He's with me. But for the
Mm.
community, sure, I still carry a lot of shame and guilt and like, oh my God, like if I out myself, I'm going to out other people and the repercussions. But we need to have these conversations. Like we need, sorry, I get really activated because I get on my soapbox. I'm like, let's talk about mental health.
Bring
We
it
are all
on.
mentally ill.
Bring it on. We're here for this. That's why
Yeah.
you're back here.
Yeah. And that's why not that obviously not that I love being depressed, obviously not, but I feel comfortable talking about it. I really feel comfortable because yeah, I am human. I'm not perfect. I don't have all the answers. I know what CBT says about reframing your thoughts and what ACT says and being mindful and all that. But man, at the end of the day, I'm human. I worked
Mhm.
50 plus hours this week. I'm exhausted. I'm not in my home country. Like,
Yeah,
Yeah.
yeah, and
it's a
yeah.
lot. And that's okay. It's okay to not
Not
be
be okay.
okay.
Yeah, and I think society is starting to move, and I'm starting to see actually some leaps and bounds in certain areas when we're able to talk about things that we maybe feel that shouldn't be spoken about in public, right? So things like feeling depressed or feeling anxious, which are again normal symptoms, right? I think that
Mhm.
sometimes the media portrays depressive symptoms or anxiety related symptoms as something that only occurs if you have a diagnosable condition.
Right.
Um, no, that it happens all the time, right? Normal things cause anxiety.
Right.
And I think or personally for me, I think not having that conversation, not expressing those thoughts, not expressing those intrusive thoughts or those intrusive acts, it really leads into maybe a development of that condition, right?
Right.
So yeah, I
Mhm.
think it all starts with a conversation like this at the dinner table to be able to speak about it naturally.
Right. And I think with the media, Ronnie, because you were kind of talking about that,
Mhm.
not only the media, but as a society, we also need to stop using mental illness as a what's the word that I'm trying to like, oh, my girlfriend is so bipolar. Or,
Yeah.
oh, I'm so OCD because I love to clean. No,
Mhm.
stop. Bipolar disorder, OCD, these are really intense mental illnesses. Because you like to clean and have your pens in a certain order does not make you an individual with obsessive compulsive disorder. So
Yeah.
that really gets me activated too, obviously, as you can tell,
Yeah.
because that just adds to the stigma and adds
Yeah.
even the whole like, oh my ex, she's so bipolar. What are you one,
What
you're
do you
using
even
it
know about it?
well, one, you're using it wrong because probably what you're trying to say is that she has borderline personality disorder, right? With the attachment issues. One. And two, just no, you
Right.
are labeling oh, crazy, oh,
Mhm.
psycho.
Yeah.
It's not people with mental illness. Like, we need to
Yeah.
stop.
I often see people, I mean, even if they have mental illness, it's just that now you are reproducing or recreating something that is going to be maladaptive to that person and to you and to others.
Mhm.
So break the cycle, right? Be the first one. If you see something that is going on, that is impairing the life of others, that this person is disturbing the life of others, including yours, there's something else to be done with you and with that person too, right? And then so when somebody says in front of me like, "Oh, this is crazy," I'm like, "Is it though? What is crazy?" And then people look at me like, "What kind of questions that leaves?" I'm like, "It's a normal question. What's normal?"
Right. Right. See, we love to have those conversations, but for like normal people, they're
Mm.
like, yeah, but it's just crazy, or oh, they're so crazy, or it-
Is it
and
though?
that, see, that to me increases it just keeps on building on that stigma, right?
Yeah.
Like you don't want to disclose that you have mental illness, oh, because you're going to be crazy, or
Mhm.
Right.
you're going to be psycho, or whatever it is.
Exactly. It just makes it difficult for people to talk about their own feelings and keep the conversations always on a very superficial level.
Mhm.
Which I guess is fine in some, circles, environments. It's okay. You don't have to like fill out all your emotions, depending on where you are. You can choose. And it's okay to choose who to talk to as well. It's just, it makes it a lot harder, even when you get to choose if the person right away is acting in a way that is sounds sentimental, it's like, or get over it, or think positive, and just
Right.
stop drinking. Like, yeah, if it was easy, maybe I would have stopped drinking long ago.
Right. Well, I always say, like, if it was so easy, I wouldn't have a job, right? I work in
Right.
addiction. If it was so easy, oh, just stop drinking. Well, hello, I need a job. Right. You
Okay,
know,
I don't think she's saying that, she wants everybody to continue drinking in a negative
right. That's
way.
not what I'm saying, but it's not that easy. That's why
Right.
Exactly.
there are treatment centers, there are services, because it's not. And even with mental illness, to me, what
Mhm.
drives me crazy, oh, it is what it is. No.
Yeah.
Yes, and we can frame that in a way of acceptance and coming to terms with it. But
Mhm.
also, to me, that kind of pushes it under the rug, and we're not sitting with it and saying, okay, this is what's going on right now. I
Yeah.
need to sit and face it. And I think almost like a grieving process in a way,
Right.
Mhm.
grieving that like old normal, right? Of
Yeah.
like, this is my life now. And how am I going to learn this new life?
Yeah. And
Yeah.
then go ahead, Ronnie.
I'm sorry. No, just one thought about people's reactions. I think that reaction is instinctual because it really does put you in a maybe not an uncomfortable place, or maybe so actually, right? So if you hear somebody talking about something that is on a much deeper level than you're used to interacting with them, I think that reaction is kind of a way to push it away. Say, I don't necessarily want to touch it too much, right? And having that conversation, even about that reaction, like, as you said, LT, well, is it actually crazy though, or what's it is this person actually bipolar? Like, what does that mean, and what does that look like to you? And why are you
Yeah.
applying the label immediately?
Yeah, exactly. And then like what is okay? Like so you've never done something that other people have said that you're crazy, when it's okay to act outside of your expectations, you tell me, then we'll do it. It's okay. So breaking that, like challenging those beliefs that people have or apply like those labels. Because I mean, I'm not gonna say all mental health professions go with that because they don't. Not everybody, is affiliated or likes or defends CBT. But for those who I guess who are aligned with CBT, I think we can, in one way, see the cognitive distortions when people are talking. Not that like we're analyzing or speaking those cognitive distortions all the time, but we can understand when people apply the labels, they're using cognitive distortions. It's triggering something inside of them. And so we're like, oh, tell me more, you know. So, uh, uh, so when we're talking about our emotions and feelings with other people or our clients, I suppose, then how can we get them to say, you know, make it okay for them if they wanted to talk about like I'm in recovery from depression or I'm recovering from an eating disorder, you know, because what we hear is that people say I'm an alcoholic, and I have difficulty with that word because there's a lot of fusion, and now it's right? It's acceptance and commitment therapy here. So there's a lot of fusion here when somebody says I'm an alcoholic, instead of saying like, you know, I'm recovering from I used to abuse alcohol in my past. And so how can we change the conversations in a way that again it goes to diffusion and it invites people also to their world?
So I love what you're asking, LT, because this is something um that I've noticed a lot too, right? Especially in the last 2 years working at the best treatment center in the nation. We are so 12-step rooted, and that term of like, oh, I'm an alcoholic came from that. And I actually
Mhm.
learned last year where that even originated from, and I thought it was so interesting. So I was listening to this lecture of one of our psychologists, and he's sharing that when Alcoholics Anonymous AA started, and when they were still able to like do research, because right now research is not allowed because the anonymity,
Sure.
um, to protect the individuals in that group, they would have a tape recorder, right, to gather the
Mhm.
data. But to protect the individuals, they would just have everybody introduce themselves as alcoholic instead of
Okay.
saying, "Oh, my name is John, I'm Dave, whatever." They would say, I'm alcoholic," and they would go around. And it
Mhm.
just kind of stuck. It just now is like the tradition, that you say, "Oh, my name is Patsy and I'm in recovery," or "I'm an alcoholic," or "I'm an addict," right? It's not the only requirement for AA is the desire to be sober. You don't have to, technically, you don't even have to be sober the moment you walk into a meeting, and it happens often. Um, the only requirement is the desire to be sober. So you don't have to identify as, "Oh, I'm so and so and I'm an alcoholic." That's just almost the tradition. Um, and in some groups, which are much more conservative and old school, how I call them, like orthodox,
Mhm.
yeah, they hold that expectation really high. But in the newer groups, in the newer home groups, they have much more flexibility. So I've had that conversation with certain patients that have that fusion, LT, that you're talking
Mhm.
about, and almost like that dissonance. So both kind of the fusion and the dissonance of like, I just don't, and then that's okay. Technically, right now, you are not an alcoholic because you're not in active use. You are in
Mhm.
recovery, right? So let's start using that language.
Yeah.
So I've had that conversation with a few patients, not all of them, because some of them, it's really important to identify as an alcoholic because it kind of keeps them accountable.
Right.
Uh,
Mhm.
but hopefully, moving forward, we can have more of these conversations of, can we think of something else? I love when patients say, "Oh, I'm a grateful recovering addict," or "I'm in recovery." They sometimes they come up with really silly things. I like that too.
Mhm.
So I see the benefit in both. However, my personal kind of desire drive is that we see more almost like that positive of like, you are in recovery, you are sober today, can we acknowledge that, versus you're not an alcoholic in active use,
Mhm.
right? And you are so much more, you're so much more than an alcoholic or
Mhm.
somebody in recovery. You're a father, you're a mother, you're a daughter, you're so many other things. And one of the issues that I have with very traditional 12 steps, like the super orthodox, is that recovery becomes like you're an alcoholic. Everything you're doing is through the lens of you're an alcoholic. You
Right.
make a good or wrong decision. Oh, it's because you're an alcoholic.
Hmm.
So much more. You're so much more than that. And you probably have mental illness too. You probably have family difficulties. There's so many other variables. Sure, your alcoholism is a big one, but there's so many other things. So I feel like sometimes we can lose sight of all the other variables that are in when we just focus on, oh, but you're an alcoholic, or oh, you have bipolar, right? We
Sure.
just
Mhm.
focus on that.
Yeah.
Sure. Sure.
Go, Ron, you gonna say something? Because I'll come back. Yeah.
No, just that I think that was, or that's one of the more difficult things for me to align with, right? Is because where I do understand the utility of saying that and putting a name to it, I think that at some point it almost becomes a label, right? And as you mentioned, doctor, it
Mhm.
that label can dictate a lot of your thinking. And the point of recovery is to get to a new place, right? A new lifestyle, a new thought process. And yes, being able to understand, okay, this is a part of me, this was a part of my life, but it doesn't make up who I am or how I function right now. And
Mhm.
I think that eventually doing away with the label as you work closer to your goal could be productive, right?
And the other thing I was gonna say is that so providing treatment and I guess talking about this topic to other people and referring again to the topic fusion and sorry guys if you guys don't know what that fusion what that means. We do encourage you guys to learn more about ACT and acceptance communication therapy. Now that you
Tell
have
us,
to
Opie.
apply.
Tell us.
So one of the challenges is, or the way that we approach with clients that I've seen before is that like, do you say that I am in pain when you're suffering from chronic pain? I am cancer if you're battling cancer. I am diabetes. You don't introduce yourself to people that way. You say I'm taking this medication, or do you even like bring it up in conversations? If it's not I don't know, if you don't want to talk about it, do you talk about it, or do you have to always present yourself? I am diabetes. No, it's just so you don't have that fusion when it comes to physical conditions. Sometimes people say I am diabetic, and then there's the fusion right there. It is just that when it comes to mental health symptoms and conditions, then they say I'm a very anxious person, or I'm very depressed, or I'm an addict. And so that poses a stigma and the label in the way that they portray themselves to others and the way that other people see them too.
Well, and now also in our clinical world, obviously patients don't understand this a lot, but for clinicians,
Mm-hmm.
we're using a lot of patient-centered language, right? So our
Mm-hmm.
patients are not alcoholics or our patients are not schizophrenic. The patient is an individual with alcohol use disorder, or the patient has schizophrenia. They are not that. They are an individual that has these symptoms. So even us as clinicians starting to use that language and moving away from that, that's what you are. Like, you are bipolar disorder.
Yeah.
No, you
Mm-hmm.
are person X who
Mm-hmm.
has a diagnosis of bipolar disorder. And again, you are a wife, a child. Like, that's where I get the most stuck. It's like, you are so many other things too. And we
Yeah.
lose sight of that. We lose sight of all the other beautiful things that we are.
Mm-hmm. Exactly. So there's so much more, and I think it's very difficult sometimes to talk about this too because it triggers a reaction in other people. It's going to trigger. It's going to bring about past beliefs, and so I do like to think that we are starting a path here. Or we are continuing a path of change. I don't know if we're going to see the change right away. Maybe in certain circles and whatnot. So I do think it's important that other people get involved in this conversation and continue, maybe even like to fight. I'm putting quotation marks here, so that more people are involved and we can change the culture.
Mhm. Again, we need to start having these conversations, right? Even think
Mhm.
about the Black Lives Matters movement. We're having these conversations. We are almost like putting in people's face, like, no, that is racist. No, you need to educate
Mhm.
yourself. No, like we keep doing these things with the BLM. Okay, so slowly, right now we have to focus on BLM, but slowly let's also start adding mental health. Let's start adding
Mhm.
addiction. people of color also suffer from addiction and mental illness,
Mhm.
and they can die at disproportionate levels than white people. So
Yeah.
we need to have, sorry, again, I get really active.
No need to apologize.
get so I get so active. And I think it just comes a lot. My experience right now, I am in such a heteronormative white um place right now, and I feel so out of place as a Latina that I'm
Mhm.
seeing it even more. And I just had an interview with somebody else who's she's a black woman in recovery, so we were having a lot of this conversation as well. But now it's like I'm constantly seeing it as a minority, because in Miami I wasn't really a minority because it's Miami. Like all of
Right.
us were Latino in some shape, way, or form, or some type of color.
Mhm.
But here in the Midwest, like I stick out like a sore thumb.
Mhm.
So I'm seeing it even more, and treating so many patients who are white. In my 2 years that I've been here in Minnesota working, I've only served two patients of color.
Wow.
That's it.
Yeah.
That's scary.
Yep.
Where is everybody else? Like,
Yeah.
where are they? So that
I
scares me.
yeah. I remember going to interviews and saying like I am literally the only brunette here. Or a person who maybe their skin tone is not, clear. So I'm wondering if this is reflective of the population that we would be seeing there. So I mean, hence, there are different days of interviews. So it just so happened that I fell in the day that there's only me there, I guess. So it's just, yeah, it's different for sure. And yeah, there's a lot
Yeah.
to that.
And I can second or third that feeling. I've been many places and interviews where I walk. I'm like, oh, okay. Like I kind of understand now.
Yeah,
I'm thrust into the minority role. However,
yeah.
Doctor, I do want to go back to a point. So you mentioned we need to have that conversation, and you alluded to BLM, and I do want to say, we need not wait until we have to have that conversation. And
Mm,
I think that's one thing that we're seeing with the BLM, that it was kind of something that was bubbling up over time, right? And with mental health, it's of course it's something that many people are not okay talking about yet, and there's still a long way to go in that realm and destigmatizing these things. But um, again, the importance of getting that ball rolling as a society, because as you mentioned, if this continues to go on, and we keep pushing it under the rug, at some point, as a society, as a nation, I don't mean to sound dramatic, but it's going to bubble over, right?
it is. Well, it is
Yeah.
already. It
Mhm.
is. We're not seeing it because we're not important. Mental
Mm.
health is not important. Addiction is not important, but it's there. It's bubbling. You can see the opiate epidemic right now. Even right now,
Mhm.
benzodiazepines, they're giving them out like candy right now.
Mhm.
Right.
Even the concept of having liquor stores open during the pandemic because they were essential, that is telling us something. So
Yeah.
we are seeing it, but we are, for whatever reason, choosing to not focus on it. And Ronnie, what I thank you for almost like giving me the permission, because a lot of what I'm struggling with BLM right now is, yeah, I want to focus on that. I want to give all my attention and energy to that, because that's the focus, right? So I'm scared. Well, one, I'm scared all the time that I'm going to mess up. I'm going to say something that's offensive. And I'm honest with that. I'm really scared because I have so much respect and I don't know a lot, right?
Right.
I
Mhm.
don't. And two, I want to focus on that. And I also acknowledge that you're right. We need to have these conversations right now and move this forward, because our people are dying, are incarcerated
Right.
at,
Mhm.
again, disproportionate rates. The
Mhm.
biggest treatment center right now is jails. That's
Yeah.
the biggest treatment center. The biggest mental health hospital, jails,
Yeah.
prisons, right? So
Yeah.
we need to start having these conversations and breaking the stigma. And I agree with you, Ronnie. We cannot wait until it bubbles up.
Mhm.
I don't know if, and I just don't want it for any society, obviously for any group,
Mhm.
but in the mental health group, I don't want a George Floyd, you
Right.
know?
Mhm.
I don't
Mhm.
want it to get to that. I don't, because I just love all my patients. I love all my people. I
Yeah.
don't want it to get to that. But if we don't have these conversations, and there's so many levels of this conversation, like I'm thinking big pharma, I'm thinking treatment, I'm thinking
Right.
jails, like so many things that we can think about. But what we have power over right now, remember how I said earlier, future tripping? I'm going to
Mhm.
give you permission to future trip. The power we have right now is to have these conversations and have
Mhm.
them. I love how you said it earlier, Ronnie, over the dinner table, through
Mhm.
your friends. Have these conversations. Let's break the stigma. And if you want to lobby, go lobby. If you want to put an Instagram post, put an Instagram post. To me, what I think our generation can do the most is being mindful of their language. I think that's one easy, simple thing that I'm a millennial, so I'll say that is be mindful of language. When you want to call somebody crazy or bipolar, or just be mindful of that. Be
Mhm.
mindful of that impact and realize that not all addicts are the junkie.
Right.
Mhm.
All around us.
Mhm. Exactly. There's so much, and we want to do so much more, like continue talking and implementing change and whatnot. And it does, you know, it's important that our listeners and other people understand that we as mental health professionals, we are humans, we have our childhood experiences, we have adaptive and maladaptive behaviors, we have deep core beliefs. I know I'm like throwing a bunch of jargons here. Just bear with me. Okay, very
We
much
have a
received it too.
history, period.
Yeah,
We all have a
yes.
We
history.
all have this.
I'm like struggling here finding words. So we have history, and a lot of times, it's taken step forward, and sometimes we'll take step backwards. And we count on some of our close friends. I tell Ronnie, just call me out. If I say something that you think that it was counterproductive, and why not? So and vice versa. So we have that relationship now, and there are other people too that feel comfortable to say like, Lizzie, how about this, and vice versa. So because as mental health professionals, we don't know it all. We don't, and we know more about certain things when it comes to mental health, but it's still there's a lot more for us to learn through research, through experience that will dictate our professional work as well as the personal experiences in the future. So when interacting with other people, there will be things that sometimes will be counterproductive, and then we do hope that like somebody will say, rethink that, or try again, and so challenge our previous beliefs and previous ways of seeing things, and there will be flips, and it's flips not in a way that like, oh, I'm thinking this and I'm being fake, it's just that
Yeah.
sometimes will say things because something negative was it activated in us, and we'll still want to do better, so we hope people can still forgive us.
Yeah, yeah, and I do want to add that I love where this conversation has gone. We've talked about so many different things, and the great thing is that it's all under the topic of recovery, right? And if we talk about the disproportionate jailing of minorities, that is a byproduct of recovery because they are not getting the full recovery, right? So then they come out in society and that process starts over again. So that is a part of the conversation. It's a part of the conversation of how we speak to others and the vocabulary that we use that you were just mentioning, LT, because again, that can be triggering to others, which is a part of recovery. And I'm starting to get more passionate about it now. So I think that a conversation like this, where the topic is just recovery, it branches off into so many different parts of our life and of our society because it's every single day. We are all actively engaging in recovery, and or contributing positively or negatively to somebody else's recovery. And that just goes back to the idea of being mindful with yourself, mindful of your environment, mindful of your context, and how you are interacting within that. I think, as we get older into this society, it can almost be like we're just, moving throughout the day mindlessly. But how important is it that we take account of how our actions affect other people, how other people's actions affect us?
I want to share something, Ronnie, that you're bringing up. So I hate pranks. Hate pranks.
Mm-hmm.
Those silly
Yeah.
videos that they have on YouTube. I
Right.
I have such an adverse reaction. I don't like being startled. Like,
Mhm.
I don't like that. And I'm going to tell you why. As funny as most people find them, I find them very triggering because it's kind of what you're saying, Ronnie. I don't know the history of that person.
Mhm.
It could just be a funny prank, or I came behind them, and I startled them. I don't know what they've been through. I
Mhm.
don't know that trigger. I don't know if they all of a sudden think they're being abused again.
Yeah.
So I have a super averse reaction to it. And that's kind of like my little piece in society of like, I don't condone it. I don't look at it. I don't do things like that because I don't want to impact negatively somebody else. And I don't want somebody else impacting me negatively. I get
Right.
so
Mhm.
easily startled. And it is anxiety provoking. So I prefer when people don't do that. So
Mhm.
that's the role, right? I love how you said it of like, we go through the day and we think we're just mindlessly going, but we do have impact on people's lives.
Yeah, and we all recovering from something, right? We all have history. We all have past experience. We all have moments of sadness, all moments of pain and different levels of pain and or anxiety or feeling lost or whatnot, right? So we all recovering from something, and that brings again to that meaning that we were discussing earlier, that it's retaining hope or gaining hope in the beginning, right? And then retaining that piece of hope and identify what I'm capable of, and then what else I can grow and strengthen, and becoming active, right? How can I engage my social support or also connect with the community, and have a personal, like, a sense of autonomy and identity and purpose in life, right? So I think we're circling back in here to the definition of recovery.
And I love that, LT, because you're right. We're all in different types of recovery, right? A lot of times we kind of think of recovery of people who are in addiction recovery, like
Sure.
Mhm.
drug and alcohol, but we all are in recovery from mental illness, from grief. Even think about the state of the world right now. I think we're all, well, I think we're still kind of going through it, but we're going to be recovering from COVID, right? From the pandemic. We're going to be recovering and entering into the new stage, God willing, of BLM, of having these conversations. So we're constantly in a state of change, hopefully for the better, right? But yeah,
Mhm.
we're all in that constant movement, hence
Yeah,
recovery.
exactly.
Yeah.
Ronnie, do you have a few words before we wrap up today's episode?
Yeah, I just want to say, as always, Dr. Patsy, thank you so much for being here. Your insight is invaluable, and the way that you put things in perspective, just on a personal level, right? Just sharing experiences and being honest. I think that's what we need more of. And as a clinician, as yourself, and as future clinicians, we are the driving force of having that conversation and normalizing these things. So thank you for that.
Yeah.
Yeah, I just want to say thank you. Also, we're very grateful that you were here and you're connecting with us. Tell our listeners how they can find you and a little bit about your project if you want.
Yeah. So I just want to say again, thank you guys. And thank you for kind of almost like going on this journey with me. It wasn't like totally what we planned, but we needed to have the
It
conversation.
was perfect.
We needed to have it. So thank you.
Just
Um,
like recovery, right?
yeah,
It's not a perfect
it's
line.
not. Oh, that's beautiful. Yes. So you can find me on Instagram at grounding deeper, at grounding deeper. Also on Facebook at Grounding Deeper. My podcast will be coming out in the fall. It is called I Am Human and I'm in Recovery. And it's a series of stories of humans, of individuals in different types of recovery, from mental illness, eating disorder, addiction, cancer, medical, all these different types of recovery. And that will be coming out in the fall. So look out for it. But for sure, follow me on Instagram. I always answer DMs. So if you need any support, any resources, I'll be happy to connect with you. Thank you guys for having me on. I really
Thank
appreciate y'all.
you. Thank you. And if you guys didn't get that, it's okay. We will be tagging her and writing her name as well as her Instagram account on our episode description in our podcast platform, as well as in social media. Our social media is Let's Psyconnect, all one word, lowercase, where we also will be posting the video for today's episode. So go ahead and watch it too. I didn't mention it before, so I'm sorry, but you can go there to our page and watch it. I hope you stay connected with us in between episodes. As I said, Instagram, we're also on Facebook and Twitter. All is going to be Let's Connect, all one word, lowercase. And if you need to get in touch with us, send us an email, discussion@letspsyconnect.com. And remember, Let's Connect.